Welcome to Ironwood Cancer Insights, a podcast dedicated to exploring a myriad of topics surrounding cancer, from diagnosis to treatment and survivorship. Episode 10.
Nutrition during and after cancer treatment.
With dietitians Laren and Brenda.
Hello, welcome back to another episode of Ironwood Cancer Insights. My name is Delaney and I'll be your host. I have registered dietitians Laren Duda and Brenda Gridley with me. We're going to be discussing some tips and tricks about nutrition and how you can help your diet through the chemotherapy process. How important does nutrition become when someone is going through chemotherapy?
Nutrition is vital when going through chemotherapy. It's going to be, different. Your nutrition before chemo and then after or during is going to be different based on all the side effects that you're trying to combat or manage. Taste alterations, nausea, bowel changes. Your diet will have to be tailored to, kind of combat some of those side effects. So nutrition is important to keep your energy levels up. Protein's very important, fluids. So, balanced nutrition as much as possible, really focusing on those healthy protein sources is vital.
And what are some common side effects that someone might have and how can they combat those side effects?
Sure. A lot of times during chemo, loss of appetite's a huge one. Mm-hmm. Gastrointestinal issues, so like nausea, vomiting, your bowel changes, taste changes is a big one as well. There's a lot that we can do kind of based on what the situation is with that patient. Mm-hmm. It's a bit individualized based on what they're experiencing. Mm-hmm. So maybe based on, what tastes they're not experiencing or what they're having maybe like increased taste of. But typically I recommend like small frequent meals and doing more bland foods if, we're a little bit more sensitive or a patient's more sensitive
mm-hmm.
to certain things.
So, taste alterations is a big one. So it could, we get a lot of metallic flavors, it's too salty or too sweet or mushy or it tastes like, cardboard. So there's various little tips that we can provide as well as, different spices or sauces that can, kind of offset some of those sensitivities or, strong flavors they're picking up. Nausea, vomiting, trying to do, like more bland, like Lauren was saying, smaller, more frequent meals, avoiding those fried, greasy foods, heavy sauces that just mm-hmm. kind of sits on top of your tummy and can make the nausea worse. Fatigue, that's why smaller, more frequent meals mm-hmm. when you're fatigued. Having that constant kind of little energy burst, exactly. Eating every couple mm-hmm. hours, right? Hydration, there's lots of little electrolyte replacement drinks out, the IV, liquid IV, Gnome, trying to stay on top of that as much
mm-hmm.
as possible too.
And then is there any foods that patients should avoid in general when they're going through chemotherapy in regards to their diet?
Yes, definitely. So we get a lot, once a patient is diagnosed, they're going to start, their treatment. They are under the impression that they have to avoid all fruits and vegetables. And that's not necessarily true. It's, it's more of like a food safety precaution. If your white blood cells are low, it's called a neutropenic diet. So we're trying to prevent any kind of foodborne illness that might occur from, any fruits or vegetables that aren't washed properly, any undercooked meats or eggs, unpasteurized milk. Sometimes, you could do the raw nuts you'd want to avoid. Obviously, sushi, unfortunately. Yeah. If you're going to have your fruits and vegetables, wash them very well in like a fit solution. If your white blood cells, are low and you need to do those neutropenic precautions, you should avoid, fruits and vegetables that are really hard to clean, like your berries, some of the ones with the thicker rinds, mm-hmm. like oranges, bananas, mangoes, those are kind of safer because the rind protects them from any of the foodborne, pesticides uh-huh. or any kind of thing that's found in the soil that you can't wash off.
And obviously, if you have any concerns, you always ask your dietitian.
Oh, yeah.
They'll help you with
Absolutely.
that.
Some other side effects that they can experience involve the mouth area. So that could be dry mouth or mouth sores, even reaching into the throat region, depending on the type of treatment they're receiving. So oral care is super important actually during treatment. So some of the oncologists will recommend, and we even recommend doing like a saltwater baking soda rinse. I'll even have patients do it before eating. It almost takes out that yucky flavor again that they might, or yucky taste in their mouth. Avoiding with dry mouth, avoiding anything that's really dry, anything with sharp edges for those mouth sores. So anything that's irritating that you can probably think of that you would not want to have in your mouth at that time. But yeah, just kind of keeping up with, keeping your mouth hydrated, drinking enough water, using those rinses to kind of keep the mouth moist and prevent any of those sores or from worsening.
So when patients don't have an appetite or they just aren't really in the mood to actually eat something, what are other ways they can supplement and get the nutrients that they need?
Yeah, definitely. There's lots of supplements out there based on people's preferences, what they, if they want to do plant-based, they want to do whey, soy. So there's different drinks, and I'm sure everyone's like kind of perused those aisles. There's protein powders that you can make smoothies from to help you, meet your increased protein needs during treatment. It's also, kind of like a convenience. Sometimes it's easier just to open one of those up and drink those versus like thinking about what you're going to eat when you're tired, or kind of offset with like certain odors from food if you're having some nausea. Side effects. So yeah, it's definitely a go-to that patients can resort to get their nutrition in. It also helps meet their hydration needs.
Absolutely. What is the ideal way to eat during survivorship or in recovery?
So it can look different for every individual, but typically after side effects have resolved or weight has been gained back, typically we want to stick to more of like our whole foods. So dietitians usually turn to the Mediterranean diet. If we were to choose a diet, that being the best one because it's very inclusive with plant foods. So like your fruits and veggies, your whole grains, your beans and legumes and seeds. So it's very plant focused, which offer a lot of anti-cancer properties or phytonutrients that can fight a lot of chronic diseases as well as cancer.
And the Mediterranean diet is also, really healthy just because of its fat profile. They focus on monounsaturated fats, which are your olive, flaxseed, avocado. These are anti-inflammatory and also very heart healthy. The diet, focuses, more on those like whole foods and leaner protein sources, eliminating a lot of your processed foods, processed meats. So your bacon, sausage, pepperoni, hot dogs, things like that. You want to try to keep out of your diet as much as possible. And interesting enough is that the Mediterranean diet, actually, if you were to look at it in a kind of pyramid kind of way, the base of it is physical activity. So everyone should be doing at least 30 to 60 minutes of whatever they're up to doing. It can be broken into 10-minute increments throughout the day. This helps with maintaining a healthy body weight, bone density, and muscle mass, which is really important as we get older.
And what are some common questions that you guys get a lot from patients that are in treatment?
Yeah, we get a lot of questions. One being, and probably one of the most popular questions is regarding sugar during cancer or during treatment or post-treatment. And there's a lot of misinformation online, surprisingly. Well, not surprisingly, but once you look online, there's actually a lot of information on there that might not be correct. But with sugar and cancer, sugar does fuel our bodies. So we don't recommend completely avoiding any form of sugar. It's kind of picking and choosing or just being mindful of the types of sugars that we're including. So a lot of our carbohydrates being, some of the ones I named, even like your fruits, your starchy vegetables like potatoes, your legumes, grains, those are good, nutritious carbohydrates for you that break down into sugar, but more of like our candies, our sweetened soda or sweetened drinks, things that just give you bursts of energy, but not long lasting and low in nutrients are the ones that we say to have in moderation. You can still include, but just not as much. Another big question we get from patients is about just diets in general, especially with the coming of fad diets and just everything you can see online and people talking about. So personally, in my counseling, I don't typically gravitate towards recommending fad diets just because a lot of them can be super restrictive, like completely eliminating entire food groups or certain types of foods that aren't always, the most healthy decisions, eliminating foods that are actually really good for us. So where I kind of go is, finding realistic ways to eat where all foods are very inclusive, but, kind of watching what's in moderation and, what to include a little bit more of. So yeah, when it comes to like fad diets, typically, it becomes kind of a cycle of restriction and then overeating a lot of times too. So it can be a tough, kind of a tough track to kind of figure out after treatment. So just finding what works best for you, and kind of gearing back to the Mediterranean diet. I feel like if you are looking for something structured, I feel like the Mediterranean diet does help in that aspect, but also does include a lot of foods and is realistic in the long run. Exactly.
And then can you guys tell me a little bit how you work with the patients and with our oncologists here?
Yeah, definitely. So we're referral based. So if a patient requests to see a dietitian or their oncologist can refer them. A lot of times we're dealing with not only just cancer, but a lot of other existing medical conditions, whether it be diabetes or kidney problems. Counseling sessions are, really individualized and tailored towards, maybe the specific cancer that we're dealing with or any of the other comorbidities. A lot of times families are involved. They have a lot of questions, or they're doing a lot of the meal preps or grocery shopping for the patients. So, not only the patients, but getting the families involved, kind of talking with our team as well as, if they need social worker, or we do have a lot of, supportive care with our different classes that we offer for exercise or support groups. So kind of helping them navigate, their journey with all the proper resources that we have to offer.
Along with our consultations that we offer, we do also contribute to the education portion on our website. So we do include blogs there, just, talking about different information regarding cancer and nutrition. And then we do have actually recipes on there. So if you're needing any, or patients are needing any kind of inspiration or just some ideas for meals, we do offer that. But if you did have, or patients had any specific questions or wanted to meet with us, they can always just ask their oncologist, both medical and radiation oncologists, or any of the providers here, and they can send a referral to see us.
Wonderful. And if you guys do have any other questions, you can always go to our website at ironwoodcrc.com, ask your provider, or give us a call at 480-821-2838. Thank you, ladies, so much for being with us today.
Thanks for having us.
Thank you, and we'll see you guys next time. Thank you.
Thank you.